nurses, opinions of family caregivers. They all feel that these drugs do play a role and can be helpful in many, many instances. Last bullet I thought was interesting, which is that about 17% of physicians felt pressured to prescribe these by the nurses, who are obviously dealing with the problem behaviors kind of every day. These are additional studies. This is a study, again, studies with risperidone that we're looking at agitation. Again, every one of these studies is positive in favor of drug versus placebo if you're focusing on agitation and behavioral problems. The same with olanzapine. Aripiprazole, again, statistically significant benefits on agitation. In this case, psychosis as well, Abilify. So just to finish up, and we'll have about 10 minutes for questions. So I feel very comfortable in recommending to you, as someone who sees these kinds of patients and their families every day, and I spend generally 1 day a week at 2 of our teaching nursing homes on Fridays for over 20, almost 25 years, that these drugs, the current therapies, do have a role to play. They're not disease modifying, they're not preventative, but they can be in fact useful. I also feel that we don't want to throw the baby out with the bathwater, as they say. It's very easy to malign the antipsychotic medications in this population, but they too have a role to play. They can have a major role, almost a life-saving role, and a role that can help improve the quality of life of the patient, the professional caregivers if they're in the nursing home, or the family caregivers if they're at home. And like any drug that we recommend, especially for this very elderly, fragile population, it's always weighing the risk-benefit ratio. In the case of acute situations, there's no time for weighing. You have to treat, and that can be very, very helpful and very effective. And keep in mind, the non-pharmacologic approaches for behavioral symptoms, and keep in mind that there may be other classes of medications, calming antidepressants. Trazodone might be an example of that, or citalopram. Again, they're not big guns. They're not going to control the patients that is out of control. But for mild irritability, especially as a way to avoid the benzodiazepines, may not be a bad idea to be thinking about. And again, the current therapies, in addition to showing the data that I showed you, which may not be so meaningful, also have shown clinically meaningful data in those 3 areas, the ABCs: activities of daily living,